we do recommend that you go with somebody that specializes in cost reports versus just any CPA. First of all, you're likely going to be charged much less when you go with a specialized cost report preparer because they're doing this in bulk and they have all their processes already down. They don't have to research anything and they don't have to pay anything additional to use the software they're going to need to use to prepare and submit the cost report. Hi, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about Medicare cost reports for your home health and hospice agency. But first, if you enjoy our content, please subscribe, like, and share with whoever you feel will find the most value. Let's jump right in. So first, we will be discussing today what is a home health or hospice cost report, why does Medicare require it, how to prepare for it, and what are the consequences of not filing. So first, what is a Medicare cost report? A Medicare cost report is a lengthy financial report that home health, hospice, and other types of healthcare facilities submit to Medicare to give a little bit of an accounting of the costs associated with the clinical care they are providing. Pretty much, this report breaks down into very small detail all of the costs, expenses, income that agencies are receiving. And the purpose of this report is to help Medicare set the payment reimbursement rates for all of these different kind of healthcare, industry types. Every year, Medicare uses this data in aggregate. So they take all of the agency cost reports and then they get averages, and this is how they set their differences in the payment adjustments and things like that. So if you're new to the industry, you might be wondering if this applies to you. Well, first of all, if you have a provider number, whether you're a home health or hospice agency, then you are required to file a cost report. But depending on the level of billing you have, you might fall into one of three cost report categories. The cost report categories are full cost report, low utilization cost report, or no utilization cost report. So how do you determine which category you fall into? If your agency has billed over $200,000 and has received over $200,000 of Medicare reimbursement in your previous fiscal year, then you are filing a full cost report. Most agencies have fiscal years that align with the calendar year, so January 1st through December 31st. If this is your company, then your cost reports are due on May 31st. Pretty much, if you have billed over $200,000 in your fiscal year, then you are submitting a full cost report. If you have billed under $200,000, but have received any amount of Medicare reimbursement, you are now filing a low utilization cost report. This means you received some money, but not more than $200,000. If you have not billed anything at all or have not received any Medicare reimbursement in the previous fiscal year, then you are filing a no utilization cost report. Each one of these cost reports has different filing requirements and requires different and a different amount of information. And so determining which cost report applies to you is critical to filing on time and avoiding the consequences. Now, again, as previously stated, the cost report is due 5 full months after the end of the fiscal year. For most agencies that span fiscal years, January 1st to December 31st, this falls on May 31st. However, if your fiscal year is different, then your cost reporting due date will be different as well. So what happens if you don't file your cost report? If you don't file the cost report or you don't file it on time, then all Medicare payments will stop. That doesn't mean that your provider number is revoked. It just means that Medicare will not give you any payments until that cost report is filed and accepted. If Medicare receives your cost report within the appropriate time frame, but it takes longer to get accepted, they will not stop your payments as long as it ultimately does get accepted. If your cost report is not accepted, you will have to resubmit, and at that point will be subject to these consequences of Medicare non-payment until submission and acceptance of the cost report. So how do we make sure that our cost report is accepted on time? The first question is, who will be doing the cost report? It is our recommendation that if you are filing a low or full cost report, that you do this with a professional who does cost reports for a living. If you will be working with such professionals, please make sure you understand that this is their busy season. Giving them their information like 1 week before the cost report is due will almost ensure that your cost report will arrive late to Medicare, and you will be again placed on the non-payment list. And so the day your cost report arrives is very important. If you're going to be working with a professional who specializes in cost reports, please ask them what is the absolute latest deadline that you can give them information so that they can file on time. Often, these professionals are also accountants. And so a lot of times you will have their busy season doubled, both with taxes and cost reports being due around the same time. Taxes, as you know, are due around April, and cost reports are generally due around May. And so you really want to work on getting this information to them, like by March at the latest, so that they have enough time with their workload to work on your cost report and also to address any kind of issues that may come up in the preparation of your cost report. This way, you're not scrambling at the very end to make sure things are done in time. If your cost report is rejected or submitted late, you may face a very lengthy acceptance process if it arrives at CMS near the deadline that most agencies have, which is May 31st. If you're submitting your cost report like in July or September, it usually takes about 1 to 2 weeks for it to get accepted. However, if you're submitting late and in like June, you're looking at a month to 2 months of waiting for acceptance of the cost report. This is because the cost report analysts are going through thousands of other cost reports and you're placed on a list. So please make sure you are submitting these things on time and not just close to the due date, but so much in advance that if there's any additional questions from both CMS or the person preparing it, that there's enough time to go and do the back and forth. So what information do you need to put together to submit a successful cost report? First and foremost, agencies should try to get their corporate taxes done as soon as possible to have the complete financial picture to submit to their cost report preparation specialist so that that person can use that same information on the cost report. You're going to need your taxes to give to that person. They're also going to need a trial balance and general ledger, any kind of like 1099s that you might have from any place that has paid you, like Medicare or Medi-Cal or Anthem, like any of these insurance companies that you might be working with. And you're going to need your expense reports. And so, as you can see, having your taxes done in advance is going to be really helpful in assembling these documents. You're also going to need information from your home health or hospice software on utilization data. Utilization data is pretty much like how many visits did you do? How many visits per age? How many visits per discipline? How many visits per insurance? Things like that. This also can break down into hours, minutes, and other categories that really help summarize your services in a statistical way for Medicare to then interpret how their payments are being allocated and used. Most home health and hospice softwares have all of the reports you'll need to submit a successful cost report. And so you're not going to be like aggregating visit data or anything like that. If you're thinking about how to choose a software, please make sure to confirm this information. But any software that's been around for any amount of time should already have this built in, but it doesn't hurt to ask. You will also need to have a breakdown of your administrative versus field costs. This means how much do you pay your administrator, DPCS, how many hours do they work, and things like that. Cost reports have detailed breakdowns on office usage and other costs like medical supplies and things like that. To prepare for all of this, you want to make sure that all of the important visit data is entered into your software and that you have all of your financial ducks in a row. Again, doing your taxes early will help the person preparing the cost report have all of this finalized information on hand. Other information includes payroll data and any kind of bad debt reports, any kind of like credit information, but all of this also goes into your taxes. So another question could be, should you do this yourself? Again, if you're doing a low or full cost report, we highly recommend going with a specialist. Specialists can be CPAs, but they don't have to be licensed per the requirements. We do recommend that you go with somebody that specializes in cost reports versus just any CPA. First of all, you're likely going to be charged much less when you go with a specialized cost report preparer because they're doing this in bulk and they have all their processes already down. They don't have to research anything and they don't have to pay anything additional to use the software they're going to need to use to prepare and submit the cost report. If you go with an average CPA that doesn't know how to prepare cost reports, you're probably going to pay a much higher fee if they take your case at all. This is because they're going to do a lot of research trying to figure out what it is they need to do and how to prepare this. They're also going to have to pay for the software that they need to submit the cost report data. The cost report data software costs some kind of upfront like download fee or some kind of like implementation fee for the person using it. And so if you are the sole customer of this, like let's say CPA that you hire that's never done this before, you'll be paying the full cost of that software for your one cost report versus somebody who's doing this for a living. They're already paying it and that cost is going to be incremental and included in your fee. Like we said, it doesn't have to be a CPA that does the cost report. The important thing is that they know how to do it and they can successfully submit it. This will be evidenced by the acceptance of your cost report. Don't be alarmed if the cost report isn't immediately accepted but goes through a round of corrections. This is normal. It's totally fine as long as it ultimately gets accepted without causing you payment delays. That's the most important part. If you are doing a no utilization cost report, meaning you have not received any Medicare reimbursements, then we highly recommend you do this yourself. It's not hard. It's like a couple of pages and you can get this done within like an hour on your own probably. But you must be sure that you have not received any Medicare reimbursements. If you submit a no utilization cost report, but you have received even 1 cent from Medicare, that falls into the low category. Your cost report will be rejected. You will then have to go to a preparer who will put you at the end of their list at the end of a very lengthy list. And then you will, once submitted, be at the end of a very lengthy list of cost reports that were submitted that the analyst now has to review. So you really want to be certain of which cost report category you fall into before deciding if you're going to DIY or go with a professional. That's pretty much all the information you need to know about cost reports. Please make sure that you are starting this preparation early and that you are identifying the person who will be preparing and submitting the cost report way in advance so that your agency doesn't get stuck with a late submission resulting in non-payment for an extended period of time that can put your agency in extreme financial jeopardy, especially if you only work with Medicare. That's the biggest tip that we can give you. I wish you the best of luck in your cost report journeys. Thank you so much for watching. Again, this is Mariam Treystman from the Home Health Consultant. And if you've enjoyed this video, please like, subscribe, and share with others. Thank you so much.